If part of you is wondering, what if I panic when labor gets intense? This is for you. That fear of the unknown, of not feeling in control, it's exactly why I created My Essential Birth. So you're not walking into birth hoping it goes well. You're walking in knowing what to do. Right now, it's $100 off, just $197, and you'll get the Mother's Day bonus bundle, including the empowering meditation track, birth affirmation audio and cards, and the birth partner quick reference guide. So when things get intense, your mind knows how to stay calm, and your birth partner knows exactly how to support you without having to guide them through it. Go to myessentialbirth.com/get started, all one word, and start feeling ready for your birth today.
There's never going to be a risk-free decision, unfortunately. Like, I wish we could all just say, like, I choose this and I eliminate, any other concerns. That's not the case. So like, if we're really knowledgeable of both sides, we should acknowledge that we are going to encounter a risk. So our choice is, what gives me the greatest amount of peace? What education can help with this decision? But then what do we do to diminish risk? I just want people to be informed, and from information, that's where we can find, not perfect peace, because again, we recognize that there's risks to every decision, but we can find a level of peace knowing that we're informed, we're making this decision from a place of information, and we have a plan in place should we encounter risks.
Getting pregnant and giving birth are two of the most exciting things you can ever hope to experience in this life. The moment you think you could be pregnant, you're frantically searching for all the best information, which is why you're here today. I'm Stephanie King, and with my many years of experience as a professional childbirth educator, doula, and lover of all things pregnancy, birth, and postpartum, I'm here to make preparing for your birth enjoyable, empowering, and totally easy. Each week, I'll cover different topics, interview professionals, and get into the nitty-gritty birth stories from mamas just like you. And when you're ready for more, you can join me in the My Essential Birth course at myessentialbirth.com, where I take you step by step through exactly how to prepare your mind, body, spirit, and partner for a birth you love. So let's get started. All right, I reached out to Dr. Ari once. It was actually kind of when all this Tylenol and autism thing started coming to play. And we know that this has been a big topic of conversation here in the United States. And so I wanted to bring an expert, and Dr. Ari Calhoun is that expert for us today. We're going to go over a couple of questions with her and kind of those hot topic things that moms are Googling right now. And so if that's you, if you're feeling a little unsure about all the decisions coming up, this episode is definitely going to be one that you love. So let me introduce her just a little bit. She is a naturopathic doctor specializing in pediatric neurodevelopment and perinatal brain health, integrating biomedical and functional approaches to support children with autism, ADHD, and neuroimmune conditions. So today, like I said, we're not only going to talk about that very controversial topic, but we're going to dive into a couple of things. And I wanted to hit on some of her expertise because the goal here is always make sure that you guys have information that allows you to make those informed decisions from a place of confidence instead of feeling overwhelmed and not understanding the options that are in front of you. So with that, Dr. Ari, will you kind of tell us a little bit about you and kind of what started the work that you do today, kind of your passion for that?
Yeah, well, thank you for having me. So yes, as mentioned, I'm a naturopathic doctor, and I'm the owner of Wholesome Brain Medicine, which is my now virtual medical clinic serving a couple different states. We have 3 providers, and our focus is really on neurodevelopment and emotional well-being of our children. And from a neurodevelopment standpoint, we believe, very strongly that this doesn't just start at birth, but it starts at conception and even prior to conception. So a big part of my passion and work has been working with moms in that preconception and pregnancy time period to address risk factors and minimize risk of, not only neurodevelopment conditions, but factors that could impact emotional well-being. So that's kind of, in terms of how I got into this field, it's kind of a long, winding story. I think I've always had an interest in the brain. I grew up in a family where my father was a psychologist. And so kind of this idea of emotional well-being was always top of mind. And I was interested in health from a very young age. And so I majored in exercise physiology and nutrition. And after kind of going through my undergrad, I had anticipated going into general medical school, but I became a little bit disillusioned with the traditional medical system and decided I wanted to look into something different. And I found naturopathic medicine. And from there, I really actually just started working in the infertility preconception world and realized that helping families get pregnant was not enough. And a lot of the families that were struggling to conceive were also encountering many of these risk factors that impact their children's long-term health and development. And so I fell in love with these families, these kids, and have just kind of made it my focus because I felt as though if I really wanted to serve this population, I needed to zone in and do it really well. And so I'm here now and I love it. And I'm a mom of two. And that's also kind of driven my passion further because I think we all deal with some level of challenges when it comes to supporting our own kids, not only neurodevelopment, but their emotional well-being. And so, yeah, that's what brought me here.
Oh, well, I'm glad you're here. And I love that we're talking about it now. That's why, because this is pregnancy and birth, right? That's what this podcast is all about. But you talking about the importance of hitting on these things preconception, like before you are even pregnant, and then what that looks like to follow it through and how that affects our mental state or neurodevelopment as you're talking about, leading on to the emotional side of things too, which I think is really interesting. So if we could, I'd love to dive into that hot topic first, that Tylenol versus autism and what that looks like. So that's been a big topic of conversation here in the United States. I'd love to hear kind of how you gathered information and what you've learned about it and what you feel like parents are asking and kind of how you respond to their needs.
Yeah. Well, I love that you frame me as an expert, but I would not call myself an expert in this topic because there's many people that are way smarter than I am that have looked into this topic. But obviously, given kind of my area of focus, this is something that comes up in conversation a lot with my patients, and it is something that I've looked into and, continue to try to understand as the evidence evolves. And so I think that that's where we are right now. The evidence is evolving. And in some ways, we have more questions than firm answers, such as science around autism in general. So that doesn't necessarily intimidate me or kind of inhibit me from having an opinion on the matter. But, there's two kind of opposing belief systems here. In general, I think what is important to know is that Tylenol, like every other drug or any other thing that we take into our body, needs to be metabolized and eliminated. And in the process of metabolizing and eliminating Tylenol, there can be a byproduct. There is a byproduct that is created that can be harmful to the developing brain. And that is not, argued. We know that. And so the question is, what is the dose that makes the poison, which is always the question, right? We're exposed to millions of toxins every single day. So at what point does that create potential harm? And as we all know, there's variability in individuals. And so some individuals are going to be going through a critical time period where they're going to be more susceptible to that toxin. And some individuals are going to be slower or faster eliminators of that toxin. And so we've, identified, and this really, didn't start that long ago. I think it was in 2008 when the conversation came up around Tylenol. And that was also at the heat of the time where we were looking at vaccinations and their potential association with autism. But there were people that realized that, we have many kids that have been vaccinated or not been vaccinated, and that doesn't always change the autism rates. But the variable that does seem to coincide more strongly is Tylenol use. And so that's what really started that conversation. And then since then, there's been a number of animal studies that have come out, and animals metabolize toxins or not toxins, they metabolize Tylenol, acetaminophen, in the same ways that humans do. So it's a good comparator study. And they have found that we can induce significant brain damage to young mice pups when given Tylenol. And so that really kind of started a lot of the research and the questioning around, okay, we have a plausible mechanism. We see that it kind of is true in animal studies. Now let's take this to human studies. And there has still been, competing data. And I'm not going to say that it's all parsed out, but I do think one of the researchers that I have been following for a while, his name is William Parker. And I think he does a really excellent job and very compelling argument for the idea that we know that Tylenol is a neurotoxin. specifically a metabolite called NAPQ. We know that some individuals are going to be susceptible to creating more of this particular metabolite. We know that those individuals that are kind of more susceptible to creating these metabolites, those pathways or those kind of vulnerabilities have also been associated with an increased risk of autism. And we see this not only in animal studies, but we see this even in adults. When we give them Tylenol, it's shown to impair their social awareness. And so we can identify that the acetaminophen has an impact in regions of the brain that correlate with symptoms that we see in autism. So in general, and I know, there's again, still some debate around this, but I feel that the data is stronger for infancy time period, particularly early infancy up to through a year of age, than it is for pregnancy. But I think we do have to, still look at pregnancy as a vulnerable time period. There's certainly data that suggests that this is still a risk factor. And the goal should always be the lowest amount possible for the shortest duration. So I think if people are taking Tylenol, and these is where the data has been in pregnancy. So kind of beyond 5 days, kind of consecutive use is where we see greater risk. So if we're taking it for migraines or pain, that's going to be far greater risk than if we're taking it for a fever and we're using it once a day or twice a day to get some relief or to sleep. And so, and again, in early childhood, my general recommendation for my practice is none at all. We want to avoid it at all costs, because I think if there's a window that incurs greater vulnerability, the data would support that early infancy window as that's the key spot we need to be focused on.
Which is interesting, because a lot of times moms are told, particularly if they choose to get vaccines for their children, give them Tylenol. But then I feel like you're mixing these two things. Do you want to chat about that for a second? And then I want to take that back to Tylenol and autism.
Yeah. So again, I think that the question around does anything cause autism it's going to be hard to prove. Well, there is no single cause of autism. We all know that. It's multifaceted. There's various kind of risk factors that can compound on a genetically vulnerable child. So with vaccinations and autism, I think that, we are given kind of two potential risk factors coinciding at the same time that can synergistically create greater levels of oxidative stress in a vulnerable child. So that's really the risk. From a standpoint of acetaminophen, the risk here is that we are impacting kind of mitochondrial function. We are creating oxidative stress, and that is causing cellular damage within the brain. Now, when we add vaccinations to the mix, one of the things we know with the vaccines is that there is going to be an upregulation of inflammation and oxidative stress. So when you are stressing a pathway and then you kind of, and so the pathway is already stressed, we have more oxidative stress to begin with. We're adding to that with Tylenol. I think that creates, a instance where the vulnerability here is just heightened. And so I'm not a fan of using acetaminophen pre and post vaccination at really any cost, outside of the fact that there are limited limited tools for lowering a fever under 6 months. But definitely we do not want to utilize Tylenol as a preventative support, which is what it's been promoted as, to alleviate some level of discomfort.
Okay, so take me back to the Tylenol and autism here. I guess the first real question that comes to mind is, you're saying that there are some children that are more susceptible. Is there any way to test for or know that our child could be?
Yeah, possibly, right? So yes, and there are a couple of things. So it's metabolized through the glucuronidation and sulfation pathways. So there are genetics that you can test in infancy, because you can do this with a cheek swab that test for variations in those detoxification pathways. We could also look at glutathione SNPs, because glutathione is what binds this NAPQ and helps with neutralization elimination. So if we had variants, we call them SNPs, a single nucleotide polymorphisms, in the pathways of glucuronidation, sulfation, or kind of glutathione conjugation or creation. all of those could impact Tylenol metabolism, and that would evoke some level of susceptibility. Beyond that, there's not very many, we're not going to do a whole host of battery of tests on infants. Now, we can get some kind of, other things that kind of could increase that risk of damage or harm from acetaminophen is if there's an underlying signs of oxidative stress. So birth trauma or jaundice at birth, any sort of impaired oxygenation at birth, that would certainly suggest that this child is going to be at greater risk because they already have that foundation or baseline for increased oxidative stress, and we don't want to add to that burden.
Okay. So in pregnancy, is there anything that we can test, or is that not an option right now?
Certainly. I think that that's similar, right? So we can do the same sort of genetics that we could on the child. We do have some more advanced tests for oxidative stress that we could look at. I think that our pathways in terms of our genetics are probably the most promising at this point. And then what I generally recommend my moms who are under my care to take is N-acetylcysteine. So N-acetylcysteine, while we don't have, all the safety data out there, and that's really true of most supplements, we do have kind of this data surrounding the use of N-acetylcysteine in early pregnancy for miscarriage prevention. And again, that sort of aligns with decreased oxidative stress, increases the chances of pregnancy, like going through and decreases infertility. We also have use in the end of pregnancy. Higher doses of N-acetylcysteine have been used to protect the infant in maternal states of oxidative stress. So in the cases of things like preeclampsia, we know that protects and has been shown to diminish some harm to the fetal brain. So I feel personally very comfortable with using N-acetylcysteine. N-acetylcysteine is what is used if someone was hospitalized from Tylenol toxicity. So if they took too much Tylenol and they got Tylenol toxicity, they'd go to the hospital and they would get N-acetylcysteine. And it just helps to metabolize that NAPK toxin. So that is one of the ways that, in general, I tell my moms, if we can avoid Tylenol, that is our goal. We are not taking this for comfort. Well, not saying that we're not taking it for comfort. We don't want to take it for, we want to try everything else to support pain and headaches. If we're taking in the midst of a fever, this is the other thing that I'll say. If there is a time period in pregnancy where there carries the greatest risk, the research would suggest that's in later pregnancy, not earlier pregnancy. And so one of the topics, and we might get into it, is that I'm really focused on is the association between maternal immune activation and autism. So when mom has a fever or she has autoimmunity or some sort of thing that would create inflammation in her body, we know that there's been an association between that and pregnancy and increased risk of autism. So then the question comes, well, Tylenol is a kind of inflammatory suppressor. So then does Tylenol benefit mom in any way, right? Does Tylenol decrease the risk? And again, there is not a conclusive answer to this, but if there is a time to use Tylenol, we have greater potential benefit from that use if used in early pregnancy, because we know the rise in temperature and the rise in fever can be associated with birth defects, but we don't have that same sort of benefit equation when it's used in third trimester. And third trimester is really where we're doing a lot of the refinement of that, the brain structures, and that's where there seems to be greater vulnerability, and particularly right around the time, like during birth. So the cord blood samples of concentrations of that acetaminophen have been associated with increased risk of autism, because that's actually making it into the baby, and baby still has this circulating in their system once they're born. So in general, lowest amount possible for the shortest duration. And when we use it, for something like an illness and a high fever, we also want to support it and accompany it with N-acetylcysteine. That's what I tell my own patients.
Okay. And does that count for babies postpartum as well? Like you would use that for the babies as they're having vaccines, or if they get fevers, or should they use Tylenol?
Yeah. So in general, again, under 6 months, we don't have another option. After 6 months, then I always default to Motrin, ibuprofen, because it's just tends to be a lot more effective. We can, use it less often, but it also does not have the risk from a brain standpoint. We don't see that same concern there. So in early infancy, I really try to avoid it as much as possible. But yes, if I do have to give it, then glutathione or N-acetylcysteine would be an appropriate support. It's a little difficult to give N-acetylcysteine to a infant, so sometimes I'll have mom take it. More often than not, I'll use glutathione.
Okay. And that passes through breast milk. So if mom supplements, baby gets it if she's nursing.
Yes. And again, the amounts are minimal, more minimal than if we give the baby directly glutathione. So, but either way, that will help to minimize the buildup of that NAPQI metabolite that comes from acetaminophen that is neurotoxic.
If you've been thinking, I just don't want to feel caught off guard or out of control during birth, I hear you. Most mamas go in hoping things go smoothly, but without a clear plan, it's easy to feel overwhelmed in the moment. That's why My Essential Birth gives you a step-by-step approach so you know what to expect and how to handle it. Right now, you get $100 off, and you also get the Mother's Day bonus bundle, including the Birth Partner Guide, which is honestly like your birth partner's cheat sheet for exactly what to do and say during labor. Plus, the meditation track and affirmations to help you stay grounded instead of spiraling when things get intense. So if you're ready to feel calm, confident, and empowered, go to myessentialbirth.com/get started, all one word, and jump in today. Okay, can we take a moment and chat about vaccines?
Yeah.
And then I want to go into kind of where you were talking about where the nutrition plays a part and just, I don't know, dive kind of into like baby's brain development during pregnancy and all of that. Vaccines are another hot topic for moms that they're getting hit with, especially during pregnancy. And it feels like more being added. I think the tricky thing with vaccines in a pregnant woman is you can have a provider who says, yes, it's safe, or we've seen that it's safe. And that's so tricky to me because the only way that they're telling you their experience is by having women take it, but it's not something that can be tested because morally that's not something that you can do is have an entire population of pregnant women take something to see how it affects them and their fetus, their baby. So what are your thoughts on that? And can you kind of like walk us through those vaccines and the conversations that you have with mom?
Yeah, so pregnancy specific, right? We're talking about Tdap, RSV now, and then influenza. So in general, again, going back to this topic of maternal immune activation, we know that there's a huge body of literature that suggests that maternal immune activation, which we think about as, it's actually quite broad. So that could be anything from an infection to autoimmunity to asthma, to obesity, gestational diabetes, preeclampsia. There are a variety of different factors that have kind of fallen under this umbrella where there is an inflammatory response in mom, and that has been associated with an increased risk of autism in the fetus. And there are a couple, I would say, kind of two primary mechanisms. One is through the fact that some directly cytokines can pass through the placenta, others indirectly. They can, when mom has inflammation, that impacts the placenta. The placenta creates its own cytokine response. But these cytokines, these inflammatory molecules, can then go up into baby's brain and sensitize these immune cells called the microglia. Okay. The microglia are the early architects of the brains. They are what kind of coordinate synaptic connectivity, essentially like the architecture of the early brain. That's what they kind of help to coordinate. Now, just because mom has an inflammatory event in pregnancy does not mean, that alone is necessarily going to convey risk for autism, but it can kind of set the system or the brain into a sensitized state, so that in future acts of immune activation in the fetus, this could then put these microglia into a state where they are really disrupted in their activity. And that's called full-blown microglial activation. So again, things that are inflammatory are initiating this process. So when we talk about immune activation, again, the vast majority, there's not really been a lot of data to suggest that vaccinations are one of these risk factors, but there's also not been a lot of studies to look into that. But we know that with vaccination, in order for them to work, yes, we create antibodies, but before we create antibodies, and that's what we want to pass on, we encounter this innate immune response. And this is what creates the same cytokines that we're looking at in the face of illness or gestational diabetes. So we get a rise in these cytokines that are relevant for that kind of that microglial activation. Okay, so this does not mean, and the argument against this would be, well, this is a very transient type of immune activation, right? Like you do the injection, you might get a little bit of a local response, but if we're not getting other kind of major inflammatory responses, it's likely not enough to create harm to the fetus. And that probably is true, right? There's just like an illness, we're not worried about every cold. So when I talk about, maternal immune activation, then I get messages and a lot of fear from moms that, they cannot go outside and they're wearing masks everywhere and they're so nervous about their child bringing home any illness. That's not what we're talking about. We're talking about more severe illness with higher levels of fever or hospitalization. That's what's been studied. So the level of inflammatory response is relevant. But we do know that not everyone responds the same to vaccinations either. So for instance, I can have moms that get Tdap and have basically zero symptoms. They go on with their day. Or I can get moms who get Tdap and they have a huge, significant inflammatory response where they get a full swollen arm and they feel flu-like and they're laid out for the day, or they get full urticaria, they get hives all over their body. So those two responses are very different. Obviously, the latter increases more suspicion or risk from a neurodevelopment standpoint. The other question pertaining to Tdap specifically, and then multi-dose flu vaccines, is whether certain excipients or adjuvants could create a risk. So notably mercury and the aluminum. And that is a question that we don't have good answers. So one of the things that we know is that, this is something that enters into circulation and this can potentially, be passed to the baby. I'm in general, Tdap contains a lot less aluminum than DTaP, what we give to our babies. So the aluminum content is much lower in something like Tdap. And we know that it's going to go through mom's first pass metabolism. So she is likely to eliminate the vast majority of it. I'm more concerned about this idea of maternal immune activation. So when we counsel through this, obviously we want to look at both the benefits and the risks of all vaccinations. And the truth of the matter is Tdap is going to then offer protection for the baby in the most vulnerable time for pertussis, right? So when do we not want our kids to get pertussis? Is in the first 3 months. And what is going to provide the greatest level of protection for pertussis? That would be those antibodies that mom would pass on. And so it's still definitely relevant to the conversation. It's not, it's not a clear answer. It's not binary, yes or no, but it's rather like, okay, how has your typical response been to something like Tdap? And the other question that I talk about with my patients is, we are passing on our antibodies through second and third trimester. Yes, when we vaccinate, we get this rise in antibodies, but do we need to do that same vaccine every single pregnancy? Or is there potential way to diminish this maternal immune activation in that third trimester when we know it's that as, the kind of the riskiest time period from a brain development, and instead do that prior to conceiving? Now, that's very controversial and hasn't been studied in terms of, we've never had a study that compares pre-pregnancy vaccination versus third trimester, vaccination. But I think it's something to question and ask and consider. And I definitely do that with my patient population. As we have these discussions. I'll speak briefly on RSV because this is a vaccination that's relatively new. I think that one thing we have to always consider is your baby born in RSV season? Because again, when we're wanting protection is during those first really 2 months when they're most vulnerable to serious infection and hospitalization from RSV. And so is that the time period that you're entering into? RSV vaccine, if you're having a baby in June, is not going to be as relevant if you're having a baby in the middle of December, right? The other thing is, does mom have any sort of birth history of gestational hypertension, preterm birth, or preeclampsia? Because in the clinical trials, we had seen kind of a slight increased risk of those, or increased association with those factors. And so in general, if it were my choice and we had a baby in RSV season, my preference is still the monoclonal antibody. If we were choosing between the two, there's the RSV vaccine for moms, and then there's the monoclonal antibody for babies. My choice at this point is the monoclonal antibody for babies if I had to choose between the two.
Okay. And I guess the other question that comes up a lot is, are they necessary at all? Now, you brought up the fact that antibodies are something that mom can pass on to her baby, and particularly during those first couple of months when it's most increased. So is this kind of where you work with parents on as like a one-on-one thing? Like a mom that's taking her baby, and has to go back to work, and this baby is going to be in daycare versus a mom that's at home and kind of chilling out for the first couple of months. Is that conversation going to be different for her? Like, what does that look like?
100%, right? So first off, we could have the same risk factors in a family, and we can have a family that's way more concerned about the risk of vaccinations, and they choose a different plan than someone who's way more concerned about the risk of the illness. So ultimately, this is a parent's decision, and my job is just to inform them of the risks on both sides. And there's never going to be a risk-free decision, unfortunately. Like, I wish we could all just say, like, I choose this and I eliminate any other concerns. That's not the case. So like, if we're really knowledgeable of both sides, we should acknowledge that we are going to encounter a risk. So our choice is, what gives me the greatest amount of peace? What education can help with this decision? But then what do we do to diminish risk? So for instance, like, we'll just go back to pertussis. We know that, the highest risk of hospitalization and kind of adverse outcomes is in the first 3 months when a baby is born for something like pertussis. And that is in large part related to the fact that their respiratory structures are just so small. So if we constrict that, if we clog that with mucus, that really creates a risk from a, airway passage standpoint. So knowing that, we can say, okay, we know that the best intervention to protect them during that time is Tdap in pregnancy, because mom creates these antibodies, they go into baby, and those antibodies, mom's antibodies, are in there. And if the baby encounters pertussis, it's not going to necessarily eliminate the chance of pertussis. That's not what it's going to do, but it's going to decrease symptoms. And that's very notable in that early stage. Okay. And I was talking, like, COVID was a great example of this. We recognized during that time period that, everyone experienced it differently. And part of that had to do with your, age and health status. So if we were trying to decrease symptomology, that was going to be really important for a subset of our population. But for a large part of the population that, didn't have very severe symptoms, decreasing symptomology was, not kind of a notable reason to take the vaccination. So again, I think it's reasonable to consider Tdap. Now, if you were like, I am terrified, that doesn't sound good. Okay, that's fine. So if we don't take the vaccination, what are the risks for encountering pertussis? Now, unfortunately, pertussis is one of these illnesses that is one of our kind of the vaccine preventable illnesses, or vaccine supportive illnesses that we are most likely to encounter. So if we have a mom who is their first child and they are relatively cocooned, like, baby's not going into daycare, we're staying at home with a single caregiver, that is a much different situation than if we have a mom who has 8 kids who are all in school and, could bring something home. So it does not mean that, again, you cannot have 8 kids and not choose to do the Tdap vaccine. But then what's the next layer? The next layer, I say to parents, is you want to have a pediatrician that you trust, that you feel comfortable going to, that will not ostracize you for your decisions around vaccinations. Because if you can go in and get treatment early enough, utilize antibiotics early enough, you can also diminish the risk of symptoms. And you want to be more vigilant and aware of what's going on in my community. What are pertussis rates? Is there, have I received any notifications from the schools that this is going around? That you just want to be aware and not come into this diminishing the potential harms of the illness. And that's what I see too often when we talk about vaccinations. We either go all in on the risks around the illness, fear around the illness. The vaccine is this heralded golden shield that covers us and protects us against everything, which is totally false. Or we go the other side and we say, these illnesses are no big deal. They're a walk in a park. Why are we even vaccinating against them? Vaccines are the worst thing ever. And that's also totally false, right? So there's this middle ground where we can say, okay, what do each of these illnesses, what are the symptoms? What are the risks? How do I treat it naturally? What would I approach it with if I didn't have the vaccine? Not just naturally, also from a medication standpoint. And, what are the things that I need to look out? What does it look like within my community? Being in an every vaccine is a little bit different, but, being in an unvaccinated community in Florida might be very different than being in a, fully vaccinated community in California for something like measles. Our risk is going to be different in those two scenarios, the risk of us encountering the illness. So that's really my focus here is, and I wish it was simpler where I could just give you, well, this is the answer for you. Mm-hmm. But it's not. It's so individual to the family. And I just want people to be informed. And from information, that's where we can find, not perfect peace, because again, we recognize that there's risks to every decision, but we can find a level of peace knowing that we're informed, we're making this decision from a place of information, and we have a plan in place should we encounter risks. Either way.
Yeah. I actually think what you said was really important about the pediatrician. And I'm always telling moms, make sure that you vet and get to know a pediatrician before you have your baby, because the first thing you're talking about at that first visit has to do with vaccinations. In fact, we have vaccines that happen in the hospital that sometimes are administered by the pediatrician, or the pediatrician oversees it for your baby. And so I think that's huge. You have to have good communication with this provider, because you don't want to be scared to bring your baby in when they're sick, because what are they going to say to me about vaccination or not? And sometimes that really can be a fight if you have chosen a different route than what they are used to. So I think that's really important. The other thing that you talked about, and maybe we just touch on this really quick, but you were talking about the risk of receiving the illness. And then there's also the risk of, okay, but if my baby contracts it, or if I contract this, then what does that actually look like? And you kind of talked about that. What's the plan if my baby does, have this thing? What do we do next? And what is the risk of that? So I do think it's kind of like multi-layered there. There's a lot to it. And then there's, maybe you want to go over this as well, but isn't it true that pertussis, for example, there's different strains. So you can be vaccinated for one, but your baby could pick up another, or you could even have caregivers around your baby who have been vaccinated for one and bring in another. And so that can be tricky. And then you have like the Hep B, which, is a sexually transmitted disease. And the way that the CDC has kind of redone their vaccine schedule now, I just think it's such an interesting topic. There's just a lot there. I don't know if you want to touch on any of that. I feel like that's a really
question. This is why there cannot be a blanket statement for vaccines, because they all work differently. They all have different efficacy. They all have different risk factors. So, this is when I do vaccine education, we first just take the illnesses kind of as they are. And so what were the rates historically? What changed in the face of vaccination? What are the rates now? What's your likelihood of contracting this? And I think when we actually go through that alleviates a lot of fear for parents, because they are able to kind of quantify some level of risk. Now, some of that is going to change a little bit, more with like vaccine uptake. So for instance, like some vaccines are not intended to reduce transmission. That's not their goal. And again, we learned, I always say like COVID was just such a great learning experience for us all, because we kind of had this like false illusion, or, what was communicated is that this is reducing transmission, changing it entirely, right? Protect your grandma, take the pertussis or take the COVID vaccine. Pertussis is actually a great kind of comparator to that. And I just saw this morning, there's a lawsuit or kind of in works for those that were encouraged to take a vaccine, the Tdap vaccine, to protect their children, or to protect their, grandchildren, because the truth of the matter is it doesn't work that way. It reduces symptomology. And what's even crazier, if you actually go through it, it doesn't necessarily, again, like it reduces what they one of the studies that they utilize a lot to, convey a level of risk reduction is after you get 5 DTaP vaccinations for 1 year, you are, it's like 99% protected. Well, what does 99% protected mean? Most people would assume that means that you're not going to get pertussis. Well, that's not what it means. It means that the duration of your symptoms are going to be less than 21 days. That's what it means. But that's not explained to people, right? And that's after 5 vaccines. So what does one vaccine offer? We actually don't have great data for that. We have some to suggest like, okay, it could like reduce the risk of hospitalization by this much, right? But that's very different than an MMR vaccine, which actually does reduce transmission. Okay. So there are some vaccines that reduce transmission, but that's not the majority of them. And so even something like strep pneumonia, we're worried about meningitis. And if we think we take this vaccine, potentially it, mitigates the risk of transfer. You swab an average kindergarten class, you can have 40 to 60% of kids that have this in their nasal passages. So it is something that it's important for us to understand. What is the illness? What are the signs of the illness? Whether we're taking the vaccine or not, we want to know, when do I need to get secondary care? When do I need to get support? And what would be the treatment in this situation? And then what is the efficacy of the vaccine? If I choose to do this intervention, how much, what, to the best of our ability, how much does that reduce risk? And the truth of the matter is, this is always changing. So what we think based on clinical trials, and again, we know this based on COVID, it doesn't necessarily translate into clinical practice. And the PCV vaccine, or the pneumococcal vaccine, was a perfect example of that. What they told us, and I have changed my kind of viewpoints on this, because what they told us based on clinical trials, 10 years later, we actually get the data, was not what actually was, found in population-based studies. So just, I think in general, to kind of summarize this, things have changed. I will say, as a population, we are so much more informed. So, I really started looking into vaccinations in 2017. And at that time period, very little information was publicly available. Most parents had no idea what they were giving to their kids. And since that time, now most parents, I would say many parents, and I think it's a necessary step, they actually do know, okay, what is Hep B? What is rotavirus? What is Hib? What is, they know these illnesses. You have to know the illness to be able to know if you want to protect against the illness. Then you can look at the vaccination and ask questions about the vaccination. And there are some that are amazingly protective, really good. And there are some that aren't that protective. And then they each have their own associated risk factors. And then we can go into brands. Okay, which of the brands might be the best? Okay, what do we do if we choose to take this intervention? How can we support and regulate the immune response so that not only you create an adequate amount of antibodies and protection from it, but you also diminish that risk of potential secondary collateral damage or side effects?
That's huge, because, and I know that we don't have time to go there, but getting into the brands of all the things too, and the different ingredients that are in them. And I know for myself, I had requested certain brands or certain ingredients to not be included. And I've had pediatricians who said, no, we don't do that. And I'm like, wait, what? Like, you have it available to you. I don't understand. Yeah.
Unfortunately, from a cost-based standpoint, pediatricians will, they usually have one brand or one sort of manufacturer that they'll source vaccinations through. And so what they offer at their office is what they offer at their office. And it isn't in their, it's not, they could switch that for the whole practice, but they can't necessarily justify the cost of like sourcing it. So in those situations, what we share with patients is you can either go to another practice or you can do it at the health department, because the health department typically has all of the brands. Not everyone does, but that is an option that a lot of my patients have utilized to get the brand of choice.
I didn't know that. That's awesome. So I feel like that's a really great gold nugget of information. Dr. Ari, I want to go into, I have to ask though, like before we get started on this next portion, tell me you have some kind of class or course or instruction for parents that where they can like kind of A through Z go through this information, and you've kind of put this together. Tell me that exists.
So Dr. Alana and I, Dr. Alana Ramal and I have created the Vaccine Empowerment Program. And so that is available, and we'll give you guys the link for that. And then for those that have taken the Vaccine Empowerment Program, if you're in a state where our team is licensed, then we also offer individualized vaccine consultations thereafter if you want more one-on-one support.
Wonderful. And that's where you can kind of like, depending on your child and your situation and all of that, help you come up with something that fits your family, right?
Correct.
Okay, perfect. I'm going to put that all at the end. I just got really excited because I'm like, this is something that I would love to sit and learn from you. I just want all the information. So that's amazing. Okay, let's talk about pregnancy, and let's talk about the diet, and let's talk about those things that shape this really positive brain development or just shape it in general. Can you talk about that for a moment?
Yeah. So nutrition is like, we just know it's so foundational, but we take it for granted because we eat 3 meals a day and we don't think much beyond that. And so a lot of what's communicated in traditional pregnancy spheres is be on folate. As long as you're on folate, folic acid is usually what's recommended. You're good. You're golden. If you can take a prenatal, but it's not specified what prenatal or what is best. So from a brain standpoint, there are some really, really critical nutrients that are important for neurodevelopment. And there's differences in, long-term outcomes based on nutrient status. And so folate is one of those. And folic acid isn't necessarily the preferred form. So in my, with my patient population, we're usually looking at methylfolate or folinic acid. And there are variations between the two of those. So one thing, again, just from a neurodevelopment standpoint, that's been coming up more and more in the data and in the really news is something called folate receptor antibodies. And so these are essentially an auto antibody, just like you have an autoimmune condition against your thyroid, or you have an autoimmune condition against certain glandular tissue or your joints. You can get auto antibodies to this folate receptor. And that folate receptor is called folate receptor alpha, and is the main folate receptor that transports folate into the brain. And we know that that's associated with autism. Well, funny enough, it's also the same folate receptor that's on the placenta, and it transmits folate across the placenta. So this folate receptor antibody that can also be in moms. And if you have this is going to impair folate transfer into baby, even if your levels are perfect. And that has been associated with recurrent miscarriages. So if you're struggling with infertility, it's something that we definitely want to look into, neural tube defects, and poor or neurodevelopment outcomes. So it's been also associated with autism, because we know that folate is really important for the fetal brain. So in that particular case, the way that you can bypass some of those antibodies is by taking folinic acid, not folic acid, not methylfolate, but folinic acid. So that's just like one example of like how important nutrition can be. And when we're looking at through the lens of neurodevelopment, it's really counter to much of what what we've been told or informed about from a preconception or infertility standpoint. Now, another big nutrient that I think is super, super important is choline. And choline is going to come a lot from our animal-based products. So especially for our vegetarians or vegans, this is something that we really want to emphasize through supplementation to have adequate amounts. But that has been critical not only for that early neural tube development alongside folate, but for long-term neurodevelopment outcomes. And it's been shown to mitigate that risk in the face of maternal immune activation. So those are two examples. Iron is huge. And so, we really, every single nutrient has a role. And I look at things, I'll say that just for my own personal story, I went into pregnancy, I actually was having my own infertility issues. And this is why I was interested in that topic back then. And I fell pregnant with my daughter kind of unexpectedly. And at that time, I was not adequately nourished. I was very malnourished. I was eating healthy, but I was very malnourished. And I took a quality prenatal, but not a quality prenatal for me. And I was still restricting certain food groups. So I wasn't eating dairy, and I was very calcium deficient and vitamin D deficient, which is another important nutrient. And from that, my daughter developed severe enamel hypoplasia. And by 22 months, we had 19 cavities filled. And so it's been a journey for our family and a journey for her. And, there's so much, regret and guilt around that. And we've worked through it. But just by the simple shift of, preparing for my next son, I knew I needed to get my vitamin D up. I knew I needed to get my calcium up. I knew I wanted to eat dairy in the ways that I could. Zero dental issues, right? And so the dental practices or the dental hygiene did not change between the two, but the conditions and the nutrients did. And so I'm a really strong advocate of getting nutrient repleted prior to pregnancy. And there's been studies even showing, consecutive pregnancies back to back, if you're not repleting those nutrients, especially there's changes in facial structure because of nutrient depletion. If you're breastfeeding, this is even more nutrient depleted. So nutrition is so foundational. We are building a human being. And I think sometimes we don't actually conceptualize how incredible that is, but also how depleting that is to our body.
Yeah. Okay. So for some of these supplements that you talked about or nutrients that we need, can you tell moms food wise, because I always want to go for food first and then supplement what we're eating. Tell me where they can find those in good amounts. Like what should their diet look like?
Yeah. Well, I think, again, my general thing is we want whole foods first off, right? We want to not be eating, bars or protein powders. And that's hard in the first trimester. So give yourself some grace. And this is why I think a comprehensive prenatal can be really supportive, but we want to get our foods from, whole foods. And we want to focus on just generically a good, solid animal protein. If you have no objections to that, at each and every meal, because our protein requirements are so high, and the nutrients that are in animal protein is just it's a much richer source than what is in vegetables. And some of those key nutrients for brain development include things like B12 and choline and iodine and iron, and we could go on and on. So many of the B vitamins are richest in that animal based products. So that's kind of number one. This isn't brain science. The other thing is we want a diversity of vegetables, but and folate particularly is going to be high in our whole grains and vegetables. So that's something that, that's obviously a very important nutrient. But we want vegetables not only just for the nutrient support, but we want it for the health of our microbiome. And that to me is another critical point as we're looking at fetal, development as a whole, allergy, atopic risk reduction. We really want a healthy microbiome. So we know that it doesn't need to be a plant-based diet, but it needs to be a plant-forward diet. We need plants to really support the health of our microbiome and decrease inflammation and oxidative stress. And then dairy is a little bit controversial because there are some things that I'm like, they do, cow's milk particularly has been associated with an increased production of these folate receptor antibodies. So there are some people where I take them off. But I think in general, if you, can eat it and that it's not bothering you, not creating any sort of inflammatory response, then that is one of our biggest sources of calcium. And calcium levels have been associated. I mean, again, my daughter's was related to bone development, enamel development of her teeth, but we also know calcium is highly correlated with risk reduction for preeclampsia. So I think that I really want to focus against like eliminating a major food group that's of whole foods, and just try to eat a whole foods diet to the best of our ability, which I know I've experienced really intense nausea, and it can be difficult.
Yeah. And so with that, just curious quickly on the milk products or milk in general, do you find that women do better with that raw if they're comfortable with it, things that are less processed and as dairy goes?
So yes, I think, there's a number of there are some benefits in terms of our microbiome and kind of some of the immune modulating aspects. Two things I'll say, just kind of as to caveat that. Cow's milk in general, doesn't matter what kind of cow's milk, is still, if you have those folate receptor antibodies, particularly these binding ones, is going to be associated with higher levels of those antibodies. And if you reduce that altogether, you can potentially eliminate those antibodies. So raw or not raw, doesn't matter. They're both associated with that. The other thing is, unfortunately, I think the truth of the matter is the benefits to pasteurization are related to the kind of the bacterial counts. And I think you really, especially in pregnancy, you just really, really want to know your source, because I have had patients get GI infections, E. coli and otherwise, from raw dairy, raw cow's milk, I should say, because the cheese and stuff is usually heated to some degree. So I think you want to be wise about it. You are kind of, encountering some level of risk, but our food in general, we're encountering some level of risk with lots of food. And so to segment, one category of food as dangerous over another, I think is a little bit simplistic, right? Because we know if we eliminated everything that had some level of potential harm, we'd be eating nothing. Because right. We have, you could get a whole host of foodborne illnesses if things were not processed appropriately or, contaminated in some way.
Sure. Okay. You mentioned the maternal microbiome. Do you want to touch on that real quick?
Yeah. I mean, so again, my first interest is just the fact that we are passing on a lot of this microbiome through vaginal birth. But that colonization doesn't necessarily just happen in the kind of the birth canal. We know that there's some seeding even during kind of fetal development in utero. More than that, though, I think that we have seen that there's a strong interface between mom's microbiome and her immune response. And so even there's been really cool studies. I think there's some really awesome ones out there that get me really jazzed up. And hopefully this will translate into, some of it has been in human research, some of it's not. But between, when mom's immune system gets activated, if she has a healthier microbiome, that immune response, that inflammatory response is not as profound. Okay. So if we can get a healthier microbiome, and this was one of the studies was done in mice, if the mice has a healthy microbiome and we activate her immune response, no autism babies. If mom has an unhealthy microbiome, we activated immune response, autism babies, right? So we know that this interface impacts the kind of inflammatory cytokine release. So that's one thing. We also know that the microbiome in particular is really strongly correlated with atopic conditions. And this is more where kind of I was referencing plant-forward diets in pregnancy have been associated with decreased risk of eczema, allergies, asthma in the offspring. And that's believed to be through microbiome modulation and some of the inflammatory benefits we get there.
Okay. All right. Okay. So we talked about Tylenol. We talked about a little bit
Mhm.
about vaccines. Can we touch on SSRIs and antibiotics?
Yeah. So SSRIs, I think that we have to obviously take into consideration mom's mental health. So do I have patients that are on SSRIs in pregnancy? Yes. My goal prior to that is always to wean mom down to the lowest dose possible and keep her on the lowest dose possible throughout pregnancy, because there has been an association with SSRIs and autism and even some congenital heart defects. So there are, certain brands that, or certain versions of SSRIs that have greater safety levels than others. And so it's really working with your provider to choose the best SSRI if you can switch and get down to the lowest possible. And that not only kind of protects, some of these risks and from a fetal development standpoint, but also withdrawal that babies can face after birth. And so yes, I think that there's an association that we want to be aware of as it pertains to antibiotics. Okay. So antibiotics, we definitely don't want we don't want to not treat an infection. We want to avoid antibiotics at all costs, especially around birth. So notably, GBS is kind of like the biggest area where we use antibiotics around that birth time period. And if we were to kind of quantify the level of disruption to the infant's microbiome long term, based on what's the critical window? That critical window is birth through that first month of life. So we want to preserve that time period as much as possible. So this also goes into supporting the gut microbiome. This is something I'm usually, especially if mom has a history of GBS, we're working really, really hard to change that vaginal ecology so we're not having to use antibiotics the second time around. Or if mom has a whole history of, bacterial vaginosis or yeast infections or just gut dysbiosis in general, we may even swab if we can preconception, but even in earlier pregnancy so that we can utilize interventions earlier to really shift that microbiome to diminish the need for IV antibiotics, because there is we want to avoid them at all costs. I think that, again, that window, just kind of like Tylenol is, we want to kind of treat that birth through, first couple months of life as the golden window where we want to avoid all medical interventions or most medical interventions possible because it's such a delicate time period.
Okay, so when you're talking about antibiotics and this time period that is so crucial for the babies, does this have to do with their microbiome? Is this their neurodevelopment? Are you relating this to autism? What does that look like?
Yeah, it's their microbiome. So, our microbiome is evolving, but it is the microbiome that we're worried about. When it is impacted that early, it has a harder time to recover. And then the microbiome does have relationships to autism. So that there's actually a very strong correlation between microbiome alterations and autism, but also atopic conditions, which we see kind of rising at a similar rate, if not higher. We have, everyone has eczema and allergies and asthma these days. And so that's another, there's a strong correlation between microbiome health. And so, I go through what I call my Wholesome Brain, a kind of pregnancy birth plan. And there are things that I think are what we talk about, what do we want to put on our birth plan and how does that relate to your child's neurodevelopment? What are we asking for and why, right? And if plan A doesn't go, what's plan B? So if we can't have a vaginal birth, what does a C-section look like? Do we consider vaginal seeding? What do we ask for as it pertains to even antibiotics? So potentially avoiding antibiotics until after baby is born. And then if they want to use it prophylactically for mom, that would be a different scenario because we don't transfer as much, very little through breast milk versus through cord blood. So there's different sort of considerations around, again, what's optimal? What do we do in plan B? And then even after the fact, if you happen to have antibiotics, I'm a huge fan of utilizing testing. So Tiny Health is the test that I utilize in that early time period. And then supplementation with Keystone Bifidobacterium species to replete that microbiome, to alter kind of the microbiome and put it back into a more ideal state. So it's not a lost cause. Things happen, but we want to be active about then correcting the issues that came up.
Yeah, I love that. Okay, talk to me about the birth plan real quick, and then I might let you leave.
Okay, yeah. No, I mean, birth plan, there's a lot to this, right? So, but in general, and this is probably just like any natural birth plan, we want a spontaneous labor. We want to avoid induction of labor, in part because we want to minimize the risk of complications. And so, and because complications are associated with increased risk of autism. And so we want to, we want spontaneous vaginal birth is the goal. And part of that is because some of the interventions that we use have some potential direct correlations. Now, again, very controversial, but still Pitocin is an oxytocin analog. And there is some consideration around, utilizing Pitocin in moms. Could that change oxytocin signaling within babies, which is something that we see in, oxytocin is our love hormone, but it's also a very strong social hormone. And so there's a lot of research looking at oxytocin levels and socialization, eye contact, things of that nature. So we want to avoid that in pregnancy if possible. And usually we're looking at other alternative induction methods first and leaving that kind of last. There's also some considerations even around an epidural, not only the medication itself that's being kind of administered, but the fact that with epidurals, we're more likely to encounter a fever. So 10 to 20% of women will get a fever. And then what is that treated with? Tylenol, or just the immune activation itself. It's a higher cytokine response. So there's considerations there. Pain methods, and I'm not a big fan of, nitric oxide, but we kind of talk about at which point is this more appropriate than an epidural? At which point is an epidural potentially more appropriate than that? If we have to go through with a C-section, our hope would be that this is an elected, right? Like we get to be part of the informed. We're choosing to do this rather than it's an emergency, just because that usually means that there is some greater time to make that decision and prepare for that, but also just less risk to the baby. Usually we're rushing it if we see signs that baby's under distress. And if we are electing to do a C-section for various reasons, some women need to do this because they've had endometriosis, they've had surgeries, then vaginal seeding is something that is controversial in the States, but not in other countries. This is, just standard practice in places like Australia. What is important is that you need to take that sample prior to having the C-section. And this has been something where moms sometimes forget. You can't take a vaginal sample after you've had the C-section because there's going to be bleeding and that's going to be difficult. So a kind of a sterile, as much sterile as possible. Sterile is kind of a little bit of a misnomer in this situation, but we want to take a clean vaginal sample and we can kind of colonize baby after the fact. We want to do skin to skin. We want to breastfeed. Those are the types of things that we kind of want to prepare ourselves for. And so I also just talk through, like, if there is complications, these things arise, what do we want to ask the birth team for? So hypoxic ischemic encephalopathy is one that has essentially it's loss of oxygenation to babies. And that is a really big risk factor for long-term neurodevelopment challenges. And I have seen huge differences in my patients who have undergone hypothermia versus those who have not been given that treatment. So I just want parents to know that that is a treatment to utilize. It essentially kind of slows down the metabolism within the brain, prohibits some of the damage that's occurred. And it sounds really scary, but it's ultra protective. So if there's any risk, we want to be our own child's advocate for that. So there's obviously some things beyond that. We talk about post-birth. So, vitamin K, antibiotic eye ointments, hepatitis B, what makes sense for a baby. There, many other things around baby baths, but that's kind of a general gist of some of the things that we're looking at to, consider. Delayed cord clamping. I'm sorry, I can't forget that one. Delayed cord clamping is so crucial for babies' iron levels in that first year of life. And I don't want to give babies iron supplementation. I'm actually quite against that if we can avoid it because of the negative impacts to the microbiome. So in order to be able to avoid that, especially if you are a breastfeeding mom, we need to do everything possible to build our own iron up in pregnancy and then and hopefully delay that cord clamping so they're getting all of that iron to build up their stores through that first year of life. And so it diminishes that risk of needing to supplement.
Yeah. Okay. I feel like we've given moms a lot to go over and think through today. I'm kind of wondering, for the mom that is listening, please don't feel more stressed. I feel like when it's so much information, you feel like you need to know everything. That's not necessarily true, but knowing where to find good information and good people to lean on, like Dr. Calhoun here, I think that's where you're going to feel a little bit more relaxed about everything. If there's something that you would say to moms that are listening today, kind of as like a final thought and is encouragement as they are working, to have this baby and do all these good things, what would that be?
Oh, I know. And I love that you say that because the last thing I want to do is stress moms out. And unfortunately, sometimes it just happens naturally. And for some kind of temperaments more than another. The truth is we are all learning every single day new risk factors and kind of new things that come up. You're never going to know it all. And that should not be the pursuit. I think that the other thing that I just like really emphasize with moms is that this is never like one particular risk factor that really changes the whole trajectory. And so what we kind of want to focus on are like, what are the factors that we kind of are aware of and how can we control and diminish some of those risks? And even if you know about it, it doesn't mean that you're always going to be able to avoid certain things. And so that's not the goal. I think collectively, the more we know, the more we can kind of do better or try, be a little bit more cognizant of how to avoid certain things. And that goes a really, really, really long way. And so there are really simple things. And I actually don't, recommend, and I know this is a little bit of a tangent, but I don't recommend that moms freak out about every single little toxin out there or, again, every single little cold. That's not the intention at all. I just want moms to just generally know, okay, what are some of the things that have been more strongly correlated and how can I think through this? And like I said, we're all going to encounter something. The goal is never to encounter nothing. With both of my pregnancies with my kids, I encountered major risk factors. And what helped me feel confident through that is I knew I had this foundation of health, nutrient status, clean living that really was going to buffer that effect. And so if we're just I think the biggest thing is just prioritizing your own health. If we're doing whatever we can to support our own health, nourishing ourselves, sleeping, getting ourselves into a healthy environment with good relationships, and we are, not afraid to ask questions when something doesn't feel right, that you are in an excellent position. And so it's not about perfection. You can't strive for it. And I think if you care enough to listen to something like this, you're already likely doing 98% of the things right.
Yeah, I couldn't agree with you more. Will you let everybody know where they can find you, how they can connect with you? And I'll make sure to put all the links in the show notes as well.
Sure. So I think the most active place that I am is over on Instagram. So my handle is dr.Ari Calhoun. It's ARICALHOUN. And then you can also, if you want to peruse my website, we have some resources there, and that's wholesomebrainmedicine.com.
Okay. Well, thank you so much for being here today.
Thank you.
If you loved what you heard today, the very best way to support this podcast and help other moms to find it is to leave a quick review. I read one at the beginning of the episodes, and I would love for yours to be next. And if you're ready for even more pregnancy, birth, and postpartum goodness, come join me in the My Essential Birth course at myessentialbirth.com, where I will hold your hand and walk you through pregnancy and birth step by step so you're totally prepared for a birth you'll love. See you next week.